Good morning, everyone. I hope everyone is doing well. My name is Angelina Ceja. I am the Vice President and Chief Education Officer at AgState. And today we're going to be going over the revised CalOSHA Emergency Temporary Standards. I have our presenter, Pat Moody with Barsamian and Moody on as well.
Good morning, everybody. Welcome, and we're going to talk about the ever-changing ETS. We had quite a few changes right in a row there, where the CDC made some changes on the federal level. So CalOSHA made some changes to sort of try and coincide with the CDC a little bit. And they proposed some changes, and then they withdrew their proposals, and they proposed new changes, and they withdrew those, and they put some more in, and then the governor made them effective immediately. So anyway, we're going a little crazy there. Those of you who get my email updates were probably frustrated with me, because every other day I was sending a new email saying, hey, wait a minute, they changed it again. But we've got some set changes now to the CalOSHA ETS, and so it is these came into play back at the end of last year, and they've sort of been tweaked a little bit here and there. And this first slide just sort of shows you the things that were required. You have to have a separate and distinct COVID prevention policy. You must have one of those. If you don't have one of those, I will tell you that the state is out there looking for them. They ask for them when they show up. And if you don't have one, you will get cited for it. There are sample prevention programs on the CalOSHA website. On the very last slide of this presentation, there's going to be a link to the CalOSHA website. And if you go to that, you will find on there sample programs in both English and in Spanish that you can then take and tweak to fit your specific needs. I'm a big advocate of utilizing the draft programs or the sample programs that the state puts out as closely as you can. Keep it as intact as you can. So I mean, it's got to fit your work site, but you want to keep it as close as you can, so the state doesn't have the ability to say, hey, your plan doesn't cover this or doesn't cover that. We want to be able to say, we used your plan, so our plan can't be defective because it's the one you gave us. So we want to be able to do that. The plan is going to cover your face coverings and social distancing and testing, and who you kind of send home from work, and do you have to pay people or not pay people, and all sorts of things like that. So that there's kind of like your general IIPP, the COVID plan is going to address a lot of those things, but you do have to have a separate and distinct COVID prevention program. So make sure you get that. That has not changed. So this is just sort of the history that I kind of went over a little bit earlier. And so the most recent updates were on June 17, a couple of weeks ago. And normally when CalOSHA proposes a revision to the regulations, it has to go to a state administrative agency where they see if it violates anything, is it inconsistent with other things, and then it takes 10 days for review, and then it becomes effective. In this case, on the 17th is immediately at the end of the CalOSHA board meeting, the standards board meeting that day, the governor issued an executive order making these things effective immediately. So there was no administrative review, and these things were effective as of a couple of weeks ago. So you want to make sure that you go read the FAQs on the CalOSHA website. And again, there's going to be a link to that at the end of the program. But there's some really, really good FAQs. I don't know what's going on with the state recently, but they've been putting out good FAQs for the most part lately on lots of things. And the FAQs on this is no exception. They're pretty good. So I would strongly suggest that everybody go actually read those, and it's a pretty comprehensive list. It covers lots of things that come up, not everything, but most things that come up are covered in that. So they've changed some of the definitions in the ETS from the prior ETS. The big thing is they talk about who is a vaccinated employee, or fully vaccinated is the phrase they use, who is fully vaccinated. And you have to be at least 14 days after the second dose in a 2-dose series, or 14 days after a single dose. So if you got the Moderna or the, oh, I'm drawing a blank on the other name, but those are the 2-dose ones, you would have to wait 14 days. And if you got that Johnson & Johnson single shot vaccine, then it's 14 days after that. Once you're done with that, those things, and it's been 14 days, the employee is considered fully vaccinated. So different things then apply to vaccinated employees versus unvaccinated employees. And as we go through this, we'll talk about some of the different things that come into play when someone's either vaccinated or unvaccinated. They've changed the definition of close contact to, it's still, you have to be within 6 feet of a COVID-19 person for a total of 15 minutes within any 24-hour period. So if you're just walking past somebody, or you're in the bathroom at the same time or something like that, and it's less than 15 minutes in a 24-hour period, that's not considered close contact. Some people I know still think that if you simply walk past somebody in the grocery store or something like that, or two employees pass each other in a hallway, and one is COVID positive and one isn't, that they now have all sorts of issues. It doesn't work that way. And so the ETS has taken that into consideration with this cumulative 15 minutes in a 24-hour period. The high-risk exposure period has been changed a little bit. And so this comes into play when you're looking at who do you have to exclude, who do you have to notify, if they've been exposed to somebody. And so here's the different definitions: is those people who do get symptoms, who are positive with COVID and get symptoms. Now keep in mind, some people test positive and don't have any symptoms. Other people just have a cold and they don't have COVID-19. We don't see too much of that anymore because everybody assumes they've got COVID. But so if someone's COVID positive and they do have symptoms, 2 days prior to the symptoms until 10 days after the symptoms, and 24 hours have passed with no fever without the use of Tylenol or something to reduce the fever. If they meet those, or in that time frame, then they're considered a high-risk exposure. If they test positive but never develop symptoms, it's 2 days before the symptoms and 10 days after the specimen, the blood specimen was collected, or the nasal swab was collected for the COVID test. So either one of those are how we define the high-risk exposure period. So in a COVID case where we're talking about someone is considered a COVID case, that's a phrase they use in the regulations. It's kind of a confusing choice of words, but this is somebody who has either tested positive, has a positive diagnosis from a licensed healthcare provider. A medical provider can tell somebody that they have COVID without actually testing them. So they can diagnose them as having COVID without actually doing a test. So that's kind of different from someone who gets the test and they have a piece of paper or whatever from the doctor that says, you've tested positive for COVID. You can go to your doctor and the doctor will tell you you've got COVID even without a test. So those two, or somebody who's been ordered to isolate by like the county health department or something like that, can tell somebody, hey, you've got to isolate. They are considered positive. And then the final one is if someone has died of COVID. I think we're seeing some better numbers on that. It's the numbers are on.
Okay, so.
Oh, was that a question? Oh, no, I think someone was just unmuted themselves and was talking in their office. No worries. So, we have to look at those different things to determine who is a COVID positive person. Exposed group has been changed and solidified a little bit. We're talking about here, I had people worried that when they say an exposed group, so if somebody shows up in a packing house and they've got COVID, I had employers very worried that meant the entire facility, everybody in the entire facility was exposed, and it's not that case. It's got to be people who are in close contact with the person who is positive and would be likely or potentially likely to have the ability to contract COVID from the positive person. So, you got to look at, are they in the same area? Are they in the same rooms? How close are they? It's not the entire facility. So if someone's just, you're passing by, like I said earlier, passing by somebody in the hallway, you're not exposed. It's if you're in the same room in close contact. So you have to look at that and determine once you know who the exposed group is, then you can determine who needs to be notified that somebody was positive and they may have been exposed, that type of thing. So that's what we want to look at. So they changed exposed workplace with the term exposed group. So it makes it a little more clear that we're not talking about the entire place. It's just the group of people who potentially could have been exposed. That's a good change, I think. They have updated the definition of face covering. So the biggest thing here is that they have said now, like a scarf, some sort of the ski mask or the head, they put the thing over their head. It's called a balaclava. That you can just see their eyes with it. It's like a whole head mask. Bandanas. If you take you got a sweater and you put your sweater up over your face. Your shirt or any single layer of fabric is not considered a face covering for purposes of the ETS. They've tightened that up. So it means now a surgical mask, a medical procedure mask, one of those hospital type mask, and it's got to be at least 2 layers, not a single layer. It obviously can't have holes or anything like that, but it's got to cover the face and the mouth and nose. And but again, the big thing we saw a lot of people was with bandanas, and the bandanas are not going to meet that anymore. And we saw the people with the neck gaiters, where they sort of pull, it goes around their neck and they pull it up and cover their face with something that's been, can be pushed down around their neck. Those are no longer going to qualify as a face covering. So if you've got employees who are saying, "Hey, I'm using my neck gaiter," that's no longer going to work. Or I'm using my bandana, that's no longer going to work. The other thing, they've added things here. This respirator, they're calling a respirator, which is a little confusing, because normally when we think of respirators, we think of something that you would wear when you're working with pesticides and whatnot, that is really sort of a heavy duty protective device. What they're saying now is that the face mask, that the N95 face mask, are considered a respirator. I don't know that I would ever have made that leap in logic, but they did. So if you can find an N95 face mask, you might want to get some, because we're going to see later that if employees ask for one, you've got to provide them one. And it's got to be the N95. And there was a lot of talk back and forth at the meeting with the CalOSHA Standards Board about this issue of the N95 mask, and employers' side representatives were saying that we can't get them, we can't find them. Those are supposed to be left for hospitals and healthcare workers. Those are not supposed to be the types of things that we need to run on. And you get somebody who's buying them all up, and nobody else can get them, but they were not swayed by that. They kept that in place, and we're going to see as we go through some of the changes here in a little bit that that those N95s are going to be something you're going to have to try and get your hands on. They also talked a little bit more about, they adjusted this work site definition to again make it clear that we're not talking about the entire area. We're really talking about where somebody could have potentially been exposed to somebody who was positive with COVID. So it's not everywhere. It's a more limited area. Okay, here's a big one. Can employers require employees to be vaccinated? Can you say everybody must be vaccinated? CalOSHA took the easy way out and said, That's beyond the scope of the ETS, so we're not going to address that. But I will tell you that both the federal EEOC and the State Department of Fair Employment and Housing have said that yes, you can require vaccinations. There was a case that came down just recently in Texas where a group of nurses in a hospital protested that they would not get vaccinated. They didn't want to get vaccinated. And the court said, yes, you can require your employees to get vaccinated. So everything seems to be pointing that way. You can require it. Keep in mind that if you do require your employees to get vaccinated, you must still accommodate those employees who have sincerely held religious beliefs. There are certain religions that say you're not allowed to take vaccines. It violates their religion. And then there's people who have certain medical conditions that would prohibit them from getting a vaccine. And so if you have somebody that has one of those issues, you're still going to have to go through your interactive process with them and determine, is there a way to accommodate them? Is there not? What can we do to try and work that out and see if there's a way to reasonably work out their desire not to be vaccinated. The other thing here is the proof of vaccination. They've made it pretty easy for those of you who want to acquire proof that somebody is vaccinated, is that they can either self-attest that they've been vaccinated, and they tell you, and you keep a list of those people who have said they are vaccinated. Somebody can say, I've been vaccinated, and provide you a piece of paper from the clinic or the doctor or the hospital or wherever it is that they got their vaccine. It says, Joe Blow has received both doses of the 2-dose vaccine or whatever it might be. And you can maintain a copy of that if you want. You don't have to maintain a copy of that if you don't want. If you do keep a copy of that, it must be treated as a confidential medical record. So I would set up a separate, COVID vaccination file or something like that where you have it kept separately. If you don't want to deal with that, here's one other thing. I don't see it mentioned on here, but if you see somebody in your workplace who does not have a mask on in a place where they normally would be required to have a mask, you have an affirmative obligation to go ask them their vaccination status. So if I'm working in a field with a group and I'm not wearing my mask, and well, let's change it, because outside you don't have to have a mask anymore. If I'm working inside in a shed, whatever it might be, and I don't have my mask on, you have a obligation to ask me what my vaccination status is. You can't just assume that I've been vaccinated. You have to come ask me. And then, like I said, you can keep a list of who's been vaccinated. You can keep the proof that they provide you, whatever it might be. You can keep something separate for each employee. I've got a little vaccination form. If somebody wants one of those, you email me and I'll give you a form that you could use that I made up. There's no magic to it. It's just something I made up. But the big thing is, if you see somebody without a mask, you have to ask them their status. You can't just presume they're vaccinated. And B, you get to pick and choose how you want to have proof of vaccination, how you want to keep that, and C, to keep it confidential as a confidential medical record. There's really no change here, but keep in mind that your pre-employment, pre-workday screening or pre-transportation screening is still in place. So here's the things you can screen for, fever, chills, cough, shortness of breath, those types of things. You still have to keep that stuff confidential. And so none of that has really changed. A lot of us thought that they would come out and say, hey, you don't have to do this anymore, but they didn't. They did keep this in place. And one thing I know we mentioned somewhere here, and actually I was talking to Teresa about it right before we opened up the meeting, is that you need to keep in mind that many counties and even cities have adopted their own regulations. And generally speaking, those regulations are stricter than the CalOSHA regulations. So you still have to look at, what does your city provide for and what does your county provide for, if anything. Most do, some don't, but most do. And like I say, most are a little more stringent than the state stuff. So keep in mind that even what this is regardless of what this is, you've got to look at, is there something out there from a different jurisdiction that's going to require you to do something a little more stringent than what the state says you have to do. And that's going to vary. Trust me, at first I tried to keep up with what the different counties were doing. And then we had different cities doing it. And it was a nightmare for me trying to keep it up and present information to my clients, just because I've got clients all over the state, and so they're in different cities, they're in different counties. And frankly, I just couldn't keep up with it. If I was trying to keep up with that, I'd never got any other work done. That's all I would be able to do in any given day. But I think we've got a question down here. Somebody asked, what are the procedures for customers coming into your office? What postings do we need to put on our door? They don't specifically talk about this, but what I would do, and I'll tell you what I do, I've got a sign on the front door of my office that says, if you're vaccinated, then you don't need a mask. If you're not vaccinated, wear a mask. That's what the sign on my door says. Now, if you want to do screenings like this, where you're checking for temperature and chills and cough, you can. I've got an office that I go to for a medical deal, and they're still checking temperatures and whatnot when you go in, even after this came into effect. So if you want to do that, you can do that, but you can do less than that if you want to. You don't have to do that. So I hope that answered your question. Oh, why are we not changing pages? There we go. Okay, so face coverings, some changes in face coverings. We talked about the new definition. So we know what the new definition is. People can't wear those bandanas or whatnot, or the neck gaiters. It's got to be a specific type of face covering. The vaccinated employees don't have to wear them. Do not have to wear a face mask. Now remember, and that's anywhere, inside, outside, it doesn't matter unless we get an outbreak, and we'll talk a little bit later about what an outbreak is. Employees outside don't have to wear a face covering, again, except in the case of an outbreak situation. And that's without regard to their vaccination status outside. So outside, face masks are not required except in an outbreak situation. And inside, they're not required for vaccinated people. When you have unvaccinated people inside, or like in a car, they have to wear a face mask except when they're alone, while they're eating and drinking, so long as employees are still socially distanced. So if you've got the break room and you've got unvaccinated people and vaccinated people in there, the unvaccinated people have to wear a mask if they can't socially distance, even in the break room. So if they can separate by 6 feet, they don't have to. If they can't, they still have to. I'm sure some of you've seen some of those crazy videos online where someone has their mask on, they pull it down, take a bite real quick and put their mask back up while they chew. That's technically what you're supposed to do. I don't know anybody that actually does that, but that's technically what you're supposed to do. If an employee asks you for a face covering, you're required to provide one. And if you have employees who want to wear a face mask, regardless of whether they have to or not, you have to allow them to, unless it creates some sort of a safety hazard. So if they, people can't understand them or whatever it might be, if they have to, or they want to wear the mask, they can, unless again, it creates a safety hazard. The respirator, we talked about this a little bit. So the definition of the respirator has changed a little bit. And so those things that are designed to protect from particulate matter. And again, the most common example of that is the N95 filtering face mask. So that's what a definition, or the new definition for respirator is going to be. These must be provided by you, the employer, at no cost. When an employee requests one, whether they're vaccinated or not, if they request one, you have to give them one. For unvaccinated employees, again, if they ask for one, then when they're part of an exposed group, you have to give one. During a major outbreak, when, again, we'll see where they have a definition of major outbreak here in a little bit, you should voluntarily provide them to everybody. And again, for unvaccinated employees, upon request during employer-provided transportation. So you're going to have a stock of these to hand out when you need to. When somebody requests one, basically, you have to give them one. So here's a nice one. The social distancing requirements are essentially removed, except when we talked about the eating in the break room type of scenario. When someone's eating, if they can't socially distance, then you got to wear a mask. You're supposed to try and socially distance there, but if you can't, then they have to wear a mask. The requirement that you put in those plastic barriers and what else people put up, all kinds of, I saw some really ingenious things that people put up, different types of barriers that people put up, and that is no longer required. The things where there are exceptions are during an outbreak, and that is defined as 3 or more cases of COVID within an exposed group. So again, we talked about what the exposed group is, and it's not the entire workforce, it's not the entire facility. You look at what is the exposed group, and if you have 3 or more in that group, then you have to put the social distancing in, or where that's not feasible, you put in the partitions. Or during a major outbreak, that's 20 or more 20 or more employees with COVID-19 in the exposed group within 30 days. So it's a rolling 30-day period. If you get 20 or more, and then you have to require the employees to wear one of these respirators, like an N95 mask, and be separated by 6 feet or install the barriers. So you have to look at that one. Face masks are still recommended for unvaccinated employees when they're working outside, but you don't have to require that. And you're still supposed to, as part of your COVID prevention plan, look at ways to consider physical distancing and other barriers as part of a hazard assessment. So one of the things you're supposed to do under those CPPs is to I got a question here. So voluntary N95 fit test or not? Angel, I don't quite understand your question. Type it in again with some more detail and I'll answer it. But you're supposed to do hazard assessment when you're doing these walk around checks to see what's going on, and you're supposed to consider what are physical distancing possibilities and barrier possibilities if they're feasible. So you want to look at those things. So we have somebody from employees are asked to self-screen prior to coming to the workplace. Is that sufficient? I believe that is going to be fine as long as they've attested that they have looked at those things and said yes or no. So you're still going to want to, I would think you're going to want to have some sort of proof that the person has told you they've self-inspected. And so I think that's going to be sufficient if you have that kind of proof. And so if you do that, okay, so do employees have to be fit tested if N95 is voluntary? Again, I'm not entirely certain what it is you're asking, Angel. If the N95s are voluntary, they want one, they get one. There's nothing that you have to do to say yes, you need one, or no, you don't need one. If they ask for one, they get one. It's just that straightforward. I don't know if that's answering your question or not. Email me separately, Angel, and I'll answer your question when we're done. In housing, so they've made quite a few changes in the housing area. So if everybody in the housing is vaccinated, you don't have to do anything. You can do whatever you want. The physical distancing provisions have been removed. There's some ventilation requirements, which will be discussed a little later, that they've put into place. And there's changes to cleaning requirements and disinfecting requirements. And they point out that there's a difference between cleaning and disinfecting. There's times when you have to clean and there's times when you have to disinfect. You're still supposed to look at, is there a way to classify people or house people in these distinct groups so that if they all work in the same crew or they all ride together to work, those kind of groups, we're trying to house them together and work, they drive together, they work together. That's what you're trying to look for. The other thing, of course, is if you have everybody vaccinated, you don't have to worry really about any of this thing. You're still required to make sure everything is effectively cleaned. You've got to provide face coverings when you should provide face coverings for them to have and use, and explain to them how to use them and all that kind of stuff. You're supposed to maximize the quantity and supply of outdoor air and increasing filtration efficiency. This is one I'm not going to try and cover in great detail because it throws all sorts of scientific jargon out there about how many microns per whatever. But if you look at the FAQs, it spells it out in full detail. Encouraging residents to report COVID-19 symptoms, and the state really wants employers to encourage people to get tested. So we want to talk about getting tested. We also want to talk about getting vaccinated. There's other places where we'll see where they say they want you to encourage people to get vaccinated. The state is really big on the vaccinations and they want everybody to be vaccinated. So they're putting an obligation on employers to encourage their employees to get vaccinated. If you have to quarantine somebody because they show up positive, they get a positive test or they're diagnosed as positive, you are going to have to quarantine those people who had close contact, and the positive people, they have to have their own bathroom, they have to have their own sleeping area, that kind of stuff. Fully vaccinated employees who do not have symptoms. So let's say someone's been vaccinated, but they have no symptoms, and they somehow test positive for COVID. They're not required to quarantine if they've been fully vaccinated and aren't having any symptoms. There's a couple exemptions there for people who have just recently got over, they're 1 day or 2 days out of the exposure period. So there's some things there you're going to want to check on a case-by-case basis, but the FAQs spell that out pretty good. On the transportation issues, again, they've taken out the physical distancing requirements. So that's going to be gone. Mask mandates, if everybody's from the same household outside of work, if you got a family driving together or something like that, then they don't have to wear a mask in the vehicle. If it's emergency transportation, you don't have to. Everybody's fully vaccinated, you don't have to be wearing a mask, or if it's public transportation. If you have unvaccinated employees waiting for transportation or during transportation, you must provide a respirator for them, one of those N95 masks. So again, you're going to want to have a supply of those. So start looking for those if you haven't, and see where you can get some and have them ready to go. You must still do the pre-transportation screening for the driver and passengers. So that's something you still have to do. And you have to provide hand sanitizer still, and encourage people to use that before and after they get in the vehicle. So you want to make sure they're sanitizing their hands. The vehicles, this is where we sort of see this distinction between clean and disinfect. So they talk here about, when you're prepping the vehicle, everything that's the high contact areas, the handles, the seat belts, the armrests, the steering wheel, that kind of stuff, they must be cleaned and disinfected. They have to be cleaned and disinfected, but another employee is going to use them within a 24-hour period. So cleaning is wiping them down. Disinfected is actually using a disinfectant solution other than just wiping things down with Windex or something like that. Same thing here. For the driver area, I sort of touched that, the steering wheel and the buckles and door handles and whatnot. Again, it must be cleaned and disinfected if somebody else is going to use it within 24 hours. All right. The prior disinfection was required before each trip. This time it's if somebody else is going to be using it within 24 hours. So they've made it a little less stringent in this area. Housing has done sort of the same thing. They use this distinction between cleaning and disinfect. You got to make sure it's cleaned. You got to make sure that they're doing all this. Hit the button wrong. They're cleaning and disinfecting, after somebody was present that was COVID positive during that high-risk exposure period. And we talked about the two different definitions of high-risk exposure period. If somebody else is going to be there within 24 hours. And you're supposed to instruct people not to share dishes, glasses, cups, utensils, those kinds of things. So make sure you have that in your CPP program, that you're telling people not to do that. Housing, this is where we talked about the filtration stuff. I'm a lawyer. I'm not a air filtration specialist. So you're going to have to look for the specialized filters. That when you go and look for filters, they tell you what they are, what the value is, and so you want to make sure you get the right ones. And there's things during outbreaks that you have to do a little bit more, making sure that you get fresh air inside and things like that. So I'll let you. They have a whole. I've got a link there on the lower left-hand corner there. So if you're providing housing, you can look at that, and it really spells out in great detail what it is you're supposed to do. The employee notification requirements. So you still have to do this notification when somebody is positive or a COVID case is the term they use during the infectious period. So these are somebody who's been positive, they've been ordered to isolate like we talked about, or you got somebody who has died due to COVID. We talked about that worksite definition and this infectious period. So this is all stuff where you got to look at, who must get the notice. And I know I sent out sample AB 685 notices. Lots of other people did too. I want to think that I gave mine to AgSafe to distribute as well. So if for some reason you didn't get samples of those, let me know, and I can get you samples of what those should be. But you should have those somewhere, I'm assuming already. So the notification requirements is, you got to tell people when they've come into close contact, and we talk about work site rather than those who have been exposed. One business day, you got to notify everybody at the work site during the high infectious period. Independent contractors there, if you got FLC employees there, or you've got temp employees there, whatever it might be. And then if there is a union, you've got to notify the union as well. So that's a COVID-19 case in the workplace during that high risk exposure period. It must be written notice. They got to be able to understand it. You got to either hand deliver it, email it, text it to them, and it's got to be in a language, of course, that everybody can understand. It's an interesting thing is you have to have in that notice what your disinfection plan is. So A, we talked earlier about having a disinfection plan, but here B, it has to go into the employee notice. If they have that situation, you've got to make free testing available, and it must be paid time to employees who had close contact. You've got to provide them information regarding COVID-19 related benefits. I don't know if anybody saw in the news recently, it just happened here in the Central Valley, sort of from Fresno south a little ways. The state is going around doing these educational meetings with employees. Of course, they've got UFW representatives with them, telling people, here are your COVID benefits that you're allowed to get, and make sure you're utilizing them. And if you don't, you can sue. And so it's the labor commissioner and some CalOSHA folks and whatnot going around doing this. They made a sweep, I know, along the coast a week or so ago, and this past this week, there were 4 days in the Central Valley here going around telling people that. So you want to make sure you're up to date on that. You've got to notify people what their rights are and their benefits are when you give them this notice. So who must you give testing to? You make it available to? Unvaccinated employees with symptoms, regardless of whether they've got a close contact or not. If someone has symptoms, you got to make testing available to them if they're unvaccinated. If they're vaccinated, you don't have to. If they're unvaccinated after close contact, you've got to make it available. Vaccinated employees, really the only time you got to do it is if they have close contact with somebody and they now have symptoms. So if the vaccinated employee had contact with a COVID positive person and has symptoms, then you got to make testing available to them as well. Then of course there's any unvaccinated people in an exposed group during an outbreak. And I just got a question here. The testing made available to employees and pay them for time, or is it just if it was, yeah. So the testing, when you make the testing available, you have to tell them that you will be paid for the time it takes you to go get tested, including travel time and a mileage reimbursement. So if they've got to drive to the clinic, they get paid for the time it takes them to drive to the clinic and get tested and drive home, plus a mileage reimbursement. So they're entitled to pay. That's got to be a paid thing. If you want to send them during the workday, you can. You just keep them on the clock. If it's after hours, you can do that as well, but you do have to pay them. So it would be something where you have to pay for that. When you have a major outbreak, everybody gets tested. So if you got 20 or more within a 30-day period, then everybody's going to get tested. So the state would probably come in and mandate that at any rate, but if they don't, you're still on the hook to do so. You must make sure that you give those testing. So reimbursement for travel time and gas also include vaccinations. Yes. So the testing and the vaccinations both must be at no cost to the employee. So if they go get the test, if they go get the vaccine, it must be on paid time. It can't cost them anything. I had another question here pop up. What if they're getting tested because of a personal close contact outside of work? Do we still have to pay them for the time to get tested? So if the close contact is outside of work, then you would not have to pay for that, but you're going to have to prove that it was outside of work. So, maybe it's easier to just pay for it than try to prove that it was outside of work, unless somebody actually tells you. I got exposed by my cousin at a family picnic over the weekend. I want to go get tested. That's one thing. But if they say, I got exposed and I'm not sure how I got exposed, you gotta decide whether it's worth fighting that or not. So you must provide information on how to access testing. Again, it's no cost and unpaid time. Train employees on the symptoms, importance of obtaining a test instead of going to work if they're experiencing symptoms. And you cannot require a negative test to return to work after being off work due to COVID. So you're prohibited from requiring a negative test. This ask at no cost and unpaid time. Again, they must be sent to free testing. If you want to bring in outside testing facilities, I know that I've had a number of clients bring in testing facilities and even vaccination facilities where they just bring it right in a mobile unit, and whoever wants to get tested gets tested, and whoever wants to get vaccinated gets vaccinated. So that's an option if you choose to do that, but you can't cause the employee to incur expense that isn't reimbursed for getting tested or vaccinated. Why is it not changing pages for me for some reason? Oh, there we go. So exclusion. So when you have to exclude somebody from the workplace, I don't know why they use this word exclusion. It doesn't make a whole lot of sense, but if somebody has close contact and they have symptoms, you're going to have to exclude them. So you're going to have to look at who do you send home and say you can't come to work. Obviously all COVID-19 cases must be excluded until the return to work requirements have been met. Those return to work requirements have not changed since the beginning of the ETS. So those are still the same. So close contact with a COVID exposure, again, remember that's more than 15 minutes within a 24-hour period until the return to work requirements are met, except that if you're fully vaccinated and you don't develop symptoms, you don't have to be excluded. And again, there's an exception for some recently recovered individuals, depending on how long it has been since they've been recovered. If you face that situation, you're going to want to try and look up the FAQs, and it'll tell you exactly what the timelines are. Wage retention during the exclusion, they actually added the word wages here, so earnings and wages instead of just earnings. I'm not sure why they felt they had to make that clarification, but they did add that if you exclude somebody, then they're entitled to be paid. Now, I will tell you that when you read the whole thing together, it's very difficult for an employee to try and get paid while they're excluded. There's very few circumstances where they're entitled to be paid. I put out a newsletter on that some time ago, but it's not everybody. It's much less. So if they're excluded because they have COVID-19, then actually they're not entitled to be paid because they can't show up to work because they've got COVID. So it's kind of a screwy. The way it's written is kind of weird. And if you get questions like that, let me know, and I can help you work through those, or call your favorite attorney. And well, I'd be upset if I'm not your favorite attorney, but call some other attorney, and they can help you work through that. So it's regular rate of pay on the regular pay schedule, whatever. And you got to, but again, you want to figure out exactly who has to be paid while there is an exclusion, because it's not everybody. If they're receiving disability payments, of course, they don't get it. If they're if it's a comp injury, some COVID cases are comp covered. And so if they're getting temporary disability, then that's not covered. Or where you can show that the close contact was not work related. I sort of had that question earlier. What happens if it's away from work? In that case, you don't have to compensate them, but it is fairly difficult to try and prove that they didn't have close contact at work. It's really kind of difficult. They sort of have to tell you that they didn't, that it happened somewhere else. It's kind of hard to prove it. Again, if you want the information on the exclusion and wages, let me know. I can send you the paperwork that I put out on it. I know that AgSafe put it out when I did it some time ago, so you may already have that, but if not, let me know and I can get that for you. Return to work. So here's our return to work standards. So if you're positive and symptoms, 24 hours without a fever and without use of fever reducing medication, and your symptoms have improved, and it's been 10 days since the symptoms appeared. If you're positive for COVID but never developed symptoms, you got to wait at least 10 days after the date your specimen was collected for that positive test. So those are the two different return to work rules. Just apply those as they come up in your certain situations. Here's if someone who's had close contact, again, 10 days after the last known close contact. And people who had close contact and developed symptoms have to wait until you're treated the same as if you had COVID and had symptoms. So it's, you got to get the 10 days and from the test. Here's the other thing is you can also do it if they then test negative after they've developed symptoms and they've now tested negative, they can return to work. At least 10 days since the last known close contact, they can return. Or if they've been symptom-free for at least 24 hours without fever-reducing medications, then they can return to work. There's just been a few little name changes or word changes here. If somebody has been ordered to quarantine or isolate or stay home from work by the county health department or the state health department, something like that, they can't return to work until that period has lifted. And that's if they say, hey, you have to stay out for 2 weeks, and the person goes after a week and gets tested negative, doesn't matter, they still have to stay out. So you gotta look at that. And I haven't seen too many situations yet with my clients where we've had affirmative orders to quarantine and isolate. I've seen some, but not that many. So then you have to look at employees can return to work upon request when it's, an undue risk to the community health and safety. So as part of your plan, you got to have, so if you just got to sort of look overall, is there some reason why we wouldn't want this person to return to work? And you're going to have to really show that there's nothing you can do to return that person to work. I know I've had a client that had somebody who had an employee who claimed that they kept testing positive. They'd be positive, and then 2 weeks later they'd test positive again, and 2 weeks later they'd test positive again, and 2 weeks later they'd test positive again. It went on 3 or 4 times. And so it was, we couldn't quite figure out what was going on with this person and why they kept testing positive. But so when you have a unique situation like that, you're just going to have to look at, hey, when does it make sense to return this person to work if we've got a situation that's outside of the norm of these other things that we've just talked about? And when does it make sense to return that person to work? So that's going to be a case-by-case situation if you run into something like that. So here's our evaluation. We've got to do this ongoing review of your COVID policies and controls and say, here's what we should and shouldn't do. Do we need different ventilation? Do we need the partitions? Do we need, whatever it might be? So you want to be doing that. It should be done every 30 days or when otherwise necessary. So you should do it every 30 days. If you get positive cases in between, do it again, so that if they come out and ask you to see your records, you can show you're doing regular hazard evaluations. So you want to make sure that you've got documentation of that, and you keep it with all your COVID documentation, so that you can show that you're doing these hazard evaluations and you're considering the different things that you can do to try and protect employees from COVID. So you want to make sure you have documentation that shows that. You can't just say you're doing it. You want to have it, documented proof. Employee training and communication. The big change here is really that they want you to tell employees that they should get vaccinated, that the vaccination is safe, that it's effective, and that they like I said earlier, the state is really pushing vaccinations, and they want you to push it on your employees. I mean, the state would love it if all employers said you must be vaccinated, and then that would be a way to get virtually everybody vaccinated. Not everybody, virtually everybody, and that's what the state is really pushing for. So they want to see that you have told your employees that they should get vaccinated and that it's safe and effective, and here's how you get it, and whether they want to go to the clinic or the hospital or I think you can get it. Like my local Save Mart grocery store, pharmacy does it. Lots of drugstores do it in their pharmacy area. So that it's pretty easy to get the vaccine nowadays. Everybody seems to have supplies, and you can get it just about anywhere. So you want to tell the employees how to do that. If they come out and ask your employees about physical distancing, you're going to want them to be able to say 6 feet, and what the symptoms are, coughing, fever, that kind of stuff. You want to be able to pare it back, what it is they're supposed to know. So make sure you train them sufficiently. I can tell you, you probably all know this, when the state comes out and talks to your employees, they're going to talk to the least, educated, least paying attention employee you have. And so you want to make sure that even that person can pare it back what you want them to say to the state when the state shows up. Because I've got a number of clients get cited for saying you haven't done sufficient training, your COVID prevention program is not sufficient, you don't have a separate COVID prevention program, things like that. So you want to make sure that's all something that's there, and they can parrot that back to the state if the state comes out. Of course, you want to talk about the face coverings and which ones they're supposed to use and which ones they're not supposed to use. You want to make sure that they can say, yeah, I know that a bandana doesn't really protect me from COVID. It's really to protect the people around me if I cough or something like that, I sneeze, so that I'm not getting COVID, and spreading it out to somebody. It doesn't really prevent the person wearing it from getting it. It's to protect the person from who's wearing it from giving it to somebody else. They got to be able to talk about when they're supposed to wear it and when they're not. And so if you have concerns about it, and you don't want to deal with A, asking who's vaccinated, and B, saying when they can and cannot wear masks, you are entitled to, if you choose, to require people to wear the mask all the time, everybody all the time. If you wanted to do that, you could do that. It specifically says that in the ETS. So if you choose to do that, you can. But if you choose not to, you have to have your employees be able to parrot back what it is that they are supposed to do with face coverings. You got to talk about how you're going to accommodate people. Testing, we talked about. You got to make sure that they know you've got a CPP, that they can see it if they want. One of the things they've really highlighted this time is making sure that you have employee assistance and hazard evaluations, employee feedback. So they want to see that you have gone to your employees and asked them for suggestions on how you can better protect them from these issues, and that you're taking that, you're getting that feedback, and B, you're taking it into consideration. You're going to want to show that you've trained them on what the benefits are, the sick leave benefits and whatnot, and your policies and procedures for minimized exposure to people coming into the workplace. So you want to make sure that you've covered all of these things. The record keeping, the record keeping hasn't changed hardly. You're supposed to maintain, obviously, inspection records and your hazard evaluations, and anything you've corrected when you've done your hazard evaluations. Find something to correct. They're going to want to know that you found something that you could correct and you did it. So make sure you find something that you can correct and correct it, so that you've got proof of that. You got to make sure you've got that CPP available upon request, because they are looking to cite people and say you didn't have it on request. You got to do the same record keeping and tracking of the COVID cases, who they are, where they were in the workplace, who did they come into contact with, that kind of stuff, the dates and times and things like that. You want to make sure you document all of that, and make sure that you've got, if you're allowing people to not wear the face mask, you need to know that why they're not wearing a face mask. Is it because of a medical accommodation or something, or is it because they've been vaccinated? And you're going to make sure that you can produce that documentation if the state shows up. Here is the links to the FAQs. It's really the most important one on there. Really read that, and it answers lots of questions. And but these links will give you lots of good information. That is everything I had. Unless people have questions, I'm happy to stay here and answer questions for anybody who has questions.
Hi, Pat. I don't see anyone else in the chat function having questions, but I do have a question for you.
Sure.
So knowing our industry, what are some of the other pitfalls that we might fall into with some of the changes? One of the things that concerns me is if we are working in an indoor facility and we've got people that are vaccinated and we have people that are not vaccinated. So we've got some folks that are wearing masks, because we also know that trying to get everybody vaccinated is going to be really difficult.
Yeah.
Have people working.
Yeah.
So what are there some issues that you see with that as we're trying to protect those that haven't been vaccinated? Like, we're trying to put up some protections, but could some of those protections be also deemed like, we are discriminating because now these other individuals, we are, maybe they are doing different jobs, those kinds of things.
The one thing that I've seen that has come up already just in the last 2 weeks since this came into effect is I've had a couple of clients say, hey, we're allowing people who are vaccinated to not wear masks, and they're getting all sorts of pushback from people who, it's kind of weird, they're getting two types. One is from people who think it's unsafe to work around somebody who isn't masked. And so then the question becomes, you have to tell the employee that there's a reason why that person isn't wearing a mask, but you can't really tell them what it is because you can't disclose medical information, right? You can't say, well, that person's vaccinated, or you can't say, well, that person has COPD and they can't wear the mask because they can't breathe if they wear the mask, right? So you can't give away their vaccination status. You can't give away their medical status. You can't say this person's religion prohibits them from wearing a mask for something, I don't know what it is, or getting vaccinated. So you've got that one. And then you've got the other one who says it's discriminatory to require me to wear a mask, even if I don't have the vaccination. And it's just you got to just go back to them with I didn't write these rules, the state did, kind of thing, blame it on the state. But those are the kinds of things that I think that are the most likely to come into play. And so the first one is kind of hard because you can't tell people while somebody else is why they're not wearing a mask. All you can say is they're in compliance with our policy. And that's really, unsatisfactory answer to the person who's complaining, right? I get that, but there's not much more you can do really. Does that address your question?
No, our hands are a little bit tied in that situation.
Yeah.
It just,
Exactly.
you have all these awkward conversations that you end up getting yourself into.
Yeah. And
As
you
you're
just got to be careful how you do them. Unfortunately, there's no way around that really. Yeah.
I always have CalOSHA or Labor Commissioner or DEFA in my head, trying to give out information.
Yeah. So we got a question in the chat function. Do you have a model written program on all the new changes we can use? Yeah. So if you look at the link, the links on that last page here on the slide, it's currently up there. If you go to to that third one down, it will have model programs for you. Those are the ones that I told you on the CalOSHA website. They have model COVID prevention plans in both English and Spanish that are really pretty good. And you can tweak them a little bit to fit your place. But again, remember my caution, keep them as close as you can to the model that's given, so you don't run into a situation of the state saying, well, your plan doesn't do X, Y, Z, it's not sufficient. We want to be able to say, this is the plan is on your website. It's got to be sufficient. So keep it as close as you can to the model. So somebody asked, how do we access the links? They don't seem to be clickable. I don't know how you do that on a PowerPoint, but I will tell you that if you search CalOSHA COVID-19, the first thing that comes up will probably be this page where these links are.
I just put it up in the chat.
Yeah, there it is, right there. Okay.
And
Teresa just put it up, everybody. It's in the chat function.
And they just updated the model program on the 29th.
Yeah. So go to that page, and like I say, use their program as closely as you can. You may have to tweak this but try and keep it as close as you can to the state program.
Okay, we got another question from Vanessa.
Okay, so for outside field workers, do we have to know their vaccination status or no, since they don't have to wear a mask? No, you don't have to. So if they are only outside and it doesn't matter what their vaccination status is, unless you get to an outbreak, then they've got to wear a mask and things like that. But if they're outside, it doesn't matter.
But Pat, are we still doing health screenings?
This is a screwy one because the common sense answer and the thing that you would think is correct is no, right? You wouldn't have to, but they didn't change that. So yes, you still have to do the screenings. Well,
I would be afraid of an outbreak situation, right, and not having done my due diligence.
Right. Yeah. But it's just kind of odd to me that they're saying, hey, if you're working outside, you don't need to wear a mask. You don't have to social distance. It doesn't matter. Why do I have to screen them then? I mean, it doesn't make sense. So, but anyway, they did not change that. So yes, you still do the screenings.
Great. Thank you. Anyone else last?
There was one more that just popped up here, Teresa. Let's see. When asking if employees vaccinated, is there a model of a form we can give them. I put one together. I can't remember, Teresa, if I sent it to you to send out, but if anyone wants one, feel free to email me, or I can send it to Teresa, and Teresa, you can give it to whoever you want. But I made one up. It's super simple. There was no magic to it. It just says I've completed the vaccination course of a 2-course series or a 1-course shot, and it's been more than 14 days, so I'm vaccinated, basically. Let me send that to anybody who wants it. You guys are putting stuff in the chat box. You're putting your email addresses in there for me to send it to you. But as soon as we leave this meeting, that goes away, and I won't know who asked me or what your email address is. My email address is on the very first page of the slide. Angelina, can you go back to the very first page so people can get a look at my email address? And then you feel free to email me directly. That's fine, and I'll email it to you.
And we'll also email out the recording of this, and then also put in the resources that we've discussed today.
Okay. Someone just asked, are you gonna be sending a copy of the presentation, the slides?
We would love to, Pat, as long as it's good with you.
Yeah, I don't care. That's fine. So yeah, so AgSafe will send you a copy of the slides. My email address is on there. If for some reason you can't get that, if you Google my name, it comes right up, and you'll be able to find my firm, Barsamian Moody in Fresno, and you can. I'm easy to find, so you'll be able to reach me, and I can send you the forms or whatever. It's real easy.
Fantastic. All right.
All right. Anything else, anybody?
Last chance. You've got the legal expert right here.
Once, twice, 3 times the lady. Okay, there we go.
Well, Pat, thanks so very much for spending the last hour with us and going through this. You know, it's been difficult to kind of navigate, and so having you break it down into pieces that we can all understand, we really appreciate it. So
absolutely, my pleasure.
Thanks again for your expertise and providing your time and talent. So anyway, everyone, thank you, everyone, and have a great day and a safe 4th of July. We'll see you soon.
Have a good one, everybody.
Bye.